Hi, I'm Dr. Rahul Bharad. I welcome you all to this series What Life Has Taught Me Yesterday. Today when I'm recording this video is 18th of February 2023. I'll be talking what 17th of February has taught me in life. Today is a very special day. Today is Mahashivratri, which is the day dedicated to Lord Shiva. All Many Indian people follow this festival, and I wish you all a happy Mahashivratri. You enjoy your connection with the Lord Shiva. If possible, try to follow fast. That is very helpful. They say if you follow a fast today, it is very useful for our body also. So that was one thing. About yesterday, most important thing which happened yesterday, I attended a CME, a continued medical education. It was about liver transplant and recent advances. It was organized by Nanavati Max Hospital from Vile Parle, Mumbai, and experts from that hospital had come to Aurangabad in a hotel. The program was there. One important thing I learnt in that CME is that liver transplantations are happening more and more day by day, and recent advances are very useful for the recipients, those who need liver transplantation. Earlier they used to wait for years together. Now the system is very fast, and more people are getting benefited with recent technology. Now one of the important thing I learned is that in future, even not only brain dead but even non-beating heart patient also, patients organs like liver can be used for transplantation. So that will increase the number of donors available, because we know currently only brain dead patients are allowed to like doctors are allowed to transplant their liver and few other conditions, but not the non-beating heart. So in future, non-beating heart patients, those who have died, their heart has stopped beating, but their liver is in a specified better condition to be transplanted, those livers can be used for transplant. So that will be a very beneficial thing for all the patients who need liver transplantation. So that was it. Yesterday that CME was there, so a good learning. One of the important news I came across yesterday is about global Twitter company. Twitter company has shut their offices in major cities like Delhi in India, like Delhi and Mumbai. They are trying to cut their cost, and they have asked employees to work from home. Twitter has been in trouble since last few months and years, since their acquisition of newer companies, and lot of debt issues are there, rent issues are there. But these are somewhat alarming situation for global economy, because Twitter is one of the important company in the world, and that company also is having financial issues. So that's not a good news for the tech world, I would say. Yesterday I went to hospital. It was busy. Children are more suffering from respiratory infections, continuing to suffer from that. I was there in the hospital till almost 7:30 p.m. In the evening, before attending that CME also, I one of the patient was supposed to come to get admitted and requiring surgery. So that patient came late. So I attended that patient after that CME, and checked that patient. That patient was underwent surgery on admission immediately in our hospital. We gave care, whatever the care is needed. Most important news, one more important news I came across yesterday is about mask. You must have read it, or you may not have read it yesterday. It's a Cochrane review. If you know, Cochrane review is one of the significant review in medical literature, that they review so many studies about any topic they choose. And Cochrane review has found that using of mask has not contributed significantly in reducing spread of COVID-19. That is very shocking news actually, because we all were advised to use mask. I know it is a very significant physical barrier to prevent infection, respiratory infections. What WHO and all the Cochrane review studies have found, that using mask reduces chances of getting respiratory infections in the community, that is fine, but it did not contribute significantly, or it made very significant non-significant to little or no improvement in the prevention of transmission of COVID-19. So shall we use mask or not is a big question. that question needs to be addressed, needs to be analyzed more. uh, I cannot comment right now about that, because that Cochrane review is very respectable studies in the world. So I'll be sharing news in the description box. Please go through that link. Do read about it. It's a very important news, and we must know details about it, because we all are still using masks to prevent ourselves from newer and newer variants of COVID-19. If there is no use like such thing, I won't say there is no use. It is definitely useful for preventing dust particles and other respiratory infections also. But how much significant it prevents is a bigger question. That's the question that Cochrane review is raising. So we all should read that article. You must read. I'll be sharing that link. Please go to the link. For today, we'll stop here. That was an important lesson yesterday. Shall we use mask or not is an important question. So I leave the answer up to you. You decide, and you go through that article for sure, and for increasing your knowledge. I hope you people are liking these kind of discussions on daily basis. Whatever you are learning in this, on this channel, on these discussions, please like, share and subscribe to my channel. Bye bye.